Assalamualaikum and very good day to Prof. Dr. Syukur bin Muhammad Noor, Prof. Dr. Ahmad bin Abbas Kuti, Dr. Hani Kartini binti Agustar, and all my fellow friends. My name is Muhammad Aslam bin SHASUDDIN, alias SHAMSUDDIN, and my metric number is A181104. Today, I would like to present to all of you about scientific poster made by me based on the research paper with a title The Impact of Traffic-Related Air Pollution on Lung Function Status and Respiratory Symptoms among Children in KLANG Valley, Malaysia. This paper was published in 2020 and was written by Nur Fasiha Sohaimi and Muhammad Afif Muhammad Juharia from Department of Environmental and Occupational Health, Faculty of Medicine and Health Science, University Putra Malaysia, and Juliana Jalaluddin from Department of Environmental and Occupational Health, Faculty of Medicine and Health Science, University Putra Malaysia, and Department of Occupational Health and Safety, Faculty of Public Health, Universitas Airlangga, Indonesia. So, without further ado, let's look at the introduction. Degrading air quality has become worldwide concern since most of the population resides in areas with high pollution levels. The increasing range of vehicles in the urban area can lead to traffic-related air pollution or TRAP due to the emissions of air pollutants from the vehicles, carbon monoxide, carbon dioxide, particulate matter, nitrogen dioxide, sulfur dioxide, and total volatile organic compound such as benzene are the example of products from TRAP. The adverse effect of TRAP among children are well recognized worldwide, including in Malaysia. Children tend to be more vulnerable to air pollutants because their developmental state suggests greater susceptibility than adults at the same ambient concentration. It is important to carry out studies among children to prevent this susceptible group from developing chronic disease associated with air pollution such as bronchitis, lung cancer, and mortality during their adulthood. In Malaysia, there are few substantial studies regarding the association of TRAP that focus on primary school children in high traffic areas. Therefore, it is good chance for Malaysia to establish an environmental framework that includes management and mitigations of the emerging health impacts from the environmental hazards. So, the main objective of this study was to determine the association between TRAP with lung function and respiratory health among primary school children in Klang Valley. This study would be a baseline for implementing a mitigation plan following the National Environmental Health Action Plan NEHAP for children's environmental health. This study was a cross-sectional comparative study conducted among primary school children in high traffic areas in Klang Valley and low traffic areas in Hulu Langat, Malaysia that focused on the respiratory effect of TRAP. For the methods, firstly, the selection of school was based on proximity to high and low traffic areas. The selection was applied to comply with research characteristics which require a density of traffic at the particular school. Meanwhile, the respondents were stratified based on their ages. A total of 152 primary school children from high and low traffic areas aged 9 to 11 years old were selected by using stratified random sampling. Inclusion criteria included Malay children and free from the history of respiratory illnesses. Only a single race was chosen to maintain racial homogeneity in compliance with the standard formula for calculation of lung function status among Malay children. Several instruments were used for air quality monitoring in the study. Measurement of PM10 and PM2.5 in classrooms were taken by using dust rate DRX aerosol monitor. NO2 and SO2 were measured by using air sampling pump. TVOC was measured by using handheld VOC monitor, and Q-Track IAQ monitor was used to measure CO. These cross-sectional studies assess the exposure to TRAP in multi-level classroom from the ground floor to the first and second floor because TRAP mixes to different heights in the school building. For the assessment of respiratory health, a questionnaire, and lung function tests had been used. Two standardized international questionnaires that are American Thoracic Societies and the International Study of Asthma and Allergies in Childhood were adapted to gain information and socio-demographic background, school and home environment, asthma, allergies, and respiratory symptoms. A spirometer was used to assess the lung function status of children. Before the lung function test, anthropometric measurements were performed where the height and the weight of the respondents were measured by using height scale and electronic weighing scale, respectively. The evaluation of spirometry test was performed by comparing the obtained value with the standard value as outlined in the updated technical spirometry standards developed by American Thoracic Society (ATS) and European Respiratory Society (ERS), and it was used to obtain forced vital capacity percent (FVC percent) predicted and forced expiratory percent (FEV percent) predicted. Then, statistical analysis were performed by using Statistical Package for Social Science (SPSS) version 22. The tests used in this analysis were descriptive analysis, chi-square test, independent t-test, Mann-Whitney U-test, and multiple logistic regression. Based on the questionnaire, there were fewer male children compared to female children. There were 36 boys to 40 girls in high traffic group. The same goes for low traffic group. There were 37 boys to 39 girls. Most of the children for the high traffic group live in the urban area, while most of the children for the low traffic group live in the rural area. Lastly, most respondents' houses for both groups were located more than 5 km away from an industrial site, which were 92.1% and 97.4% for high and low traffic group respectively. The data were obtained from the measurement of trap at each high traffic school and low traffic school. Trap concentration exhibit a declining trend with an increase in floor height. The average trap result obtained are shown in Figure 1. While the comparison of trap concentration between two groups is tabulated in Table 1. As you can see in Figure 1, there were significant differences between the concentration of traps in primary schools in both high and low traffic areas, reported on PM10, PM2.5, TVOC, NO2, SO2, and CO. In Table 1, we can say that if the p-value is under 0.05, there is a significant difference in the value. As we can see, every variable gave a p-value of under 0.05. This shows that there is a significant difference in all variables for high traffic areas to low traffic areas. This is because based on the traffic count survey conducted in the study, the medium-sized vehicle had the highest number in the high traffic area. In contrast, the high number of vehicles in the low traffic areas was the small-sized vehicles. Motorcycles were classified as small-sized vehicles, while cars and vans were classified as medium-sized vehicles. Lastly, lorries and trailers were classified as large-sized vehicles, and a high number of medium-sized vehicles contributed to the high emission of traps compared to low number of large-sized vehicles. Furthermore, based on the observation during the traffic count survey, there were a lot of medium-sized vehicles idling nearby school compounds in the afternoon. It was believed that those vehicles belonged to children, parents, or guardians who were waiting for their children at the end of the school season. As shown in Figure 2, there were 4 parameters of respiratory health symptoms that were studied, which include cough, wheezing, phlegm, and chest tightness. All respiratory symptoms showed significant differences between both groups. However, only chest tightness had significant association with trap concentration in school at p-value 0.001. There were 12 children from high traffic areas and 1 child from low traffic areas who had chest tightness. These findings demonstrate that children in high traffic areas were 3 times more likely to experience chest tightness when compared to the children in low traffic areas. Wheezing Cout, and Plum showed no significant associations with TREP concentrations in school. In short, there was an association between occurrences of reported respiratory symptoms in primary school children with the location of the primary school they attend due to traffic exposure. Figure 3 shows the comparison of the lung function abnormalities between high and low traffic group. A chi-square test was carried out to compare the lung function abnormalities. Only FEV 1% showed a significant difference at P0.002 between high and low traffic groups. There were 41 children from high traffic group and 23 children from low traffic group who had an abnormality of FEV 1%. In order to estimate the probability of factors that influence chest tightness the most, a binary logistic regression analysis was conducted. As demonstrated in Table 3, NO2 was the only predictor that significantly improved the model predictive capability of adjusting for the distance of the house from roads and industrial sites, indoor smoking, ventilation system, carpets, and open burning. The prevalence ratio indicated that children who were exposed to a high concentration of NO2 in school were 40 times more likely to experience a respiratory symptom, which was determined by chest tightness. The results shows that 16.9 of chest tightness is influenced by exposure to NO2 in schools. As a conclusion, the risk of lung function decline and the occurrence of respiratory health symptom increase in children exposed to TREP, and the concentration of TREP and the respiratory symptom were substantially greater in the high traffic group than in the low traffic group. Overall, based on this current study, it is advisable to improve the level of awareness among parents, school management, and as well as the public regarding the risk of getting respiratory disease due to the TREP exposure. An annual meeting can be held among teachers, parents, and professionals to discuss the emerging issues on respiratory problem among school children exposed to TREP. These are the references that had been used in the research paper, and this study was funded by University Putra Malaysia Impact Putra Grant. With that, I will end my presentation here. I really appreciate that you took the time, listen attentively to my presentation. Thank you and goodbye.